This is a fantastic opportunity to speak about this important disease. Acne continues being, in many practice, in many countries, the first place for the patients who go with dermatologists. So this is very important to have fantastic options of treatment and to think in what have now and what could be in the future. And doing this presentation, I discovered some interesting things. The most important is that we don't have breakthrough drugs, things very important in the last 40 years. In general, we have the same resources for treat this disease, but I discovered that we are changing the way to treat the disease with the same resources. What I mean is that we have antibiotics, but we want now to use it for short times, for don't change the microbiome in the skin and the stomach and the gut, etc. We try to be more brief treatments with antibiotics, and the opportunity to use short time antibiotics is that we can use low doses of isotretinoin as soon as possible, as up as possible, because we have been for many years avoiding the use of isotretinoin, and now in the United States, the American Acne and Rosacea Society, many leaders and many forums has been speaking about the low doses of isotretinoin with the other options that we use, and the evolution of the patient is very well. Now we are using two probiotics. We discovered that if we use probiotics by mouth and inclusive over the skin, the evolution of the acne is much better. So now, if we give antibiotics, we have the opportunity to restore the microbiome, giving since the beginning probiotics, and when we stop the antibiotics, we continue giving probiotics, and we can use low doses of isotretinoin, especially in men. When we have ladies that need the treatment, we have the problem with the pregnant, etc. So we have used, for example, anticonceptives or other hormonal treatment for prevent pregnant anti-androgenic hormonals with low doses of isotretinoin, no matter the severity of acne. Because in the past, the politics of the use of this drug was only for cystic or severe acne, and a lot of people, majority of dermatologists, use low doses no matter the severity of the disease. Inclusive, the patients with severe disease, when you use high doses of isotretinoin, could be too bad and to turn to other severe acne with a flare-up, very inflammatory, inclusive we have to stop the treatment, etc. So the low doses is now the fashion for treat the patients, combined with antibiotics, short times, not too much time, and probiotics to improve the dysbiosis, because it's another term that we didn't know in the past, this dysbiosis, this change in the microbiome that we need to rebalance in the patient using probiotics and antibiotics for short times. So this is a new way to see the disease. Now we have other retinoids, new retinoids that at the end is only retinoids. It's not maybe a better profile of security, maybe less irritation, but at the end it's retinoids. And some hormonal topics like clascoterone, that is a soft anti-androgenic drug by the skin. You don't need to take it by mouth, and you can use it in men too. But the results at the moment are not very clear. We need to use for a long time and to see if this treatment is good or is suitable for all the patients. It happens sometimes with topical Dapsone that it was not very success in some way. It was launched in the United States, and not too much people use now Dapsone in gel. So maybe it will happen with other drugs. We have now minocycline in foam over the skin, but maybe in the future it will develop bacterial resistance. So we have not too much new players in the field, but we can use new strategies. The problem of adherence, in the beginning, we thought that was only in the young people who have acne. And we did a study with some company in the past with the Global Alliance, in that we include 4,000 patients. And we discovered that 50% of the patients don't do the treatment. This is a phenomenon that this is under study. We know the people don't do the treatment. If we go to diabetes, hypertension, other diseases, the same. The patients don't do the treatment. Or they take the treatment some days, or they don't, or forget to do it. There is not a perfect adherence. So we have fantastic players. The problem is the patient is not adherent in general. There is a big percentage of patients that don't do the treatment. So what are the strategies that we can do? I think it's very important now, the relation between dermatologists and the patients, to explain the acne is a disease that needs a high-level professional, because it's a complex disease, that maybe there is endocrinological situations, emotional and psychological situations that have importance in the breakouts of acne. Now we know there is an axis brain-skin gut that is very known, that the influence of this axis is very important in the acne, especially depression, anxiety, and sometimes produce breaks of acne. So we have to see the patient in a holistic way and speak about that they need a professional, a person who have a wide vision of the disease. The other thing is that we have problems with influencers. The influencers sometimes give some options to the patients that are not adequate, suitable. So it's important to say that they need a doctor. And something that I use very important is that we have the possibility to do the best for you. We have fantastic drugs. The only thing is that you do the treatment. We know our work, we know our science, so the most important is that you do the treatment. If the patient have a compromise and say that, okay, I will do it, I sometimes I say, I can write a contract with you that you will be fantastic, but we are partners. You need to work together with me, and the patient will be fine. Other thing is that not all the patients have money to buy the medicine in many countries, and if you give only 4 products, they afford only 2, and it is not the complete treatment. So this is another situation that if we are very real life thinkers, we know that in real life some patients don't have the treatment sufficient to give the best outcomes. So we have many players in the field, and we should see the patient holistically. I use sometimes antidepressives in some patients and improve a lot. They have a lot of motivation, adherence to the treatment, etc. We have to open our mind and individualize each patient. Depending of each patient, the necessities, the budget for the drugs, etc., and we can design a good plan for our patients. And the most important, to be partner with the patients and to do the motivation for the patient be adherent to the treatment. This is a risky answer, but nobody can to know, anybody can to know the future, say. But with my experience for more than 30 years in dermatology, I have seen recently that an important French company buy some technology from another Swiss company that have biotechnology, and they will start to work seriously. They pay a lot of money for the technology and biotechnology for a vaccine. This vaccine is RNA messenger. It's similar to the COVID vaccine. In the past, there was another studies trying to do a vaccine with a molecule that is called CAMP, that is Christine Atkins Munch Peterson, that is a product of the Cutibacterium acnes. But now this new technology is a little bit different. Maybe it could be something like immunotherapy, tolerance to the bacteria, and there will not be inflammation. The studies will start in 2023. There is not too much information about exactly the mechanism and the science of the vaccines, but sounds good. Otherwise, will be a revolutionary situation, because if many people get the vaccine, will not be acne in the future. This is the point. But I hope so. It works. Maybe it will be in the market. It works in 4 or 5 years, maybe after the clinical studies. Looks good for the future. Other thing that I see as the artificial intelligence, that maybe will substitute some situations, speaking about dermatologists who speak patients or see patients with acne, and maybe some apps in the telephone or something like that could be diagnosis, and maybe there are some algorithms to treat the acne. But I hope, like an old dermatologist that I am, in the old-fashioned style, old school, that is very important, the contact, the human contact, and speak with the patients, because the disease have many psychological issues. Many patients are with depression. They feel, some of them try to get suicide. There is studies that show it. So I think the human contact and to approach the patient with the medicine behind the technology, I think is important issue that we should, as a dermatologist group, continues taking care.